Schizophrenia is a complex mental health disorder that affects how a person thinks, feels, and behaves. It often manifests in early adulthood with symptoms ranging from hallucinations and delusions to avolition, anhedonia, disorganization symptoms, and catatonic symptoms. The 4 A's of Bleuler are fundamental symptoms of schizophrenia identified by Eugene Bleuler. They include affect disturbances, autism, ambivalence, and association disturbances. The 11 Schneiderian first-rank symptoms are specific symptoms that are highly suggestive of schizophrenia. They include 3 auditory hallucinations, 3 thought phenomenon, 3 made phenomenon, along with delusional perception and somatic passivity. The 3 thought phenomenon are thought insertion, withdrawal, and broadcast. The 3 made phenomenon are made volution, affect, and impulse. The 3 auditory hallucinations are third-person auditory hallucinations, running commentary, and thought echo. In this chapter, we will discuss the treatment options for schizophrenia, focusing on typical and atypical antipsychotics. Typical antipsychotics like haloperidol and chlorpromazine have been used for many years. They are effective but can cause side effects such as muscle stiffness and tremors. These side effects are known as extra-pyramidal symptoms, or EPS. EPS can include acute dystonia, akathisia, drug-induced Parkinsonism, and tardive dyskinesia. Remember the mnemonic DAPT for dystonia, akathisia, Parkinsonism, and tardive dyskinesia. Atypical antipsychotics like risperidone and olanzapine are newer and often preferred. They tend to have fewer motor side effects but can cause weight gain and metabolic issues. Therapy is another crucial part of treatment. Cognitive behavioral therapy, or CBT, helps people identify and change negative thought patterns. In this chapter, we will discuss the management of extrapyramidal symptoms. Each of these conditions requires specific management strategies. For acute dystonia, parenteral anticholinergic medications like promethazine or benztropine are often used. Akathisia can be managed with beta blockers like propranolol or anticholinergics or benzodiazepines. Drug-induced Parkinsonism is typically treated with anticholinergics like promethazine, trihexyphenidyl, or procyclidine. Tardive dyskinesia, a more chronic condition, may require switching to a different antipsychotic with a lower risk of EPS or using medications like valbenazine or tetrabenazine. It is crucial to monitor patients regularly and adjust treatment as needed to minimize these side effects and improve their quality of life. Now we will discuss the duration of treatment for schizophrenia, treatment-resistant schizophrenia, and the use of depot antipsychotics for patients with poor compliance. The duration of treatment for schizophrenia can vary, but it often requires long-term management. For the first episode, duration of treatment is from 1 to 2 years, while if patient has multiple episodes, treatment is generally given for 5 years or more. Treatment-resistant schizophrenia is a condition where patients do not respond adequately to standard antipsychotic medications. In such cases, clozapine is often considered the gold standard treatment. For patients who struggle with medication compliance, depot antipsychotics can be an effective solution. These long-acting injectable medications are administered every few weeks, ensuring consistent medication levels and improving adherence. By addressing these aspects of treatment, we can better support individuals living with schizophrenia and help them achieve better outcomes. Thank you for watching this video. Please don't forget to like, share, and subscribe this channel so that you don't miss any future updates.